me, Lauren Jaffe, and welcome to another episode of Derech Eretz. Healthcare has been at the center of most conversations over the past 2 to 3 years, and for good reason. Today we pay tribute to a mensch in his field, the late Professor Bloomson, and we learn more about Dr. Natasha Berkovitz's work during the COVID pandemic. Rabbi Kievman tells us more through a Jewish lens.
For over a decade, I've been privileged to volunteer as a paramedic for Hatzalah, which is our community's volunteer ambulance corps. The theme, the motto of Hatzalah, which inspires all the volunteers to get up in the middle of the night or whenever it is to go save a life, is the Talmudic statement that saving one life is saving an entire universe. Because ultimately, we're all here in this world together. And the macrocosmic universe is a reflection of the microcosm. And in that sense, ultimately, caring for others benefits ourselves. We care for ourselves thereby as well. From the Hasidic mystical perspective, this idea is the difference between the body and the soul. Yes, from a body perspective, there are varying degrees of strength and talents and abilities that we each have. But from a soul perspective, we all come from the same origin. We're all created in the divine image. We are all equally indispensable to God's plan for this world. We have two souls, in fact, Jewish mysticism teaches. One soul is our godly soul, and the other is our animal soul. Now, the animal is focused on the soil, on the ground. But there's another difference between soul and soil in the very letters. Soul is S-O-U-L, whereas soil is S-O-I-L. The animal is self-centered. All it cares for is itself. It's narcissistic. What can I get out of anything? Whereas the soul is care and concern for others. And that's very important in the medical profession, because the only thing that could drive another person to get out in the middle of the night is to realize, how can I be there for another? If a doctor is going into the medical profession because they think that they're going to make a great living by making a lot of money in that field, they should find a different business to go into. Ultimately, a doctor who's in it sincerely to care for others and to heal the world around them, that doctor will probably be very prosperous as well, because that altruism, that care and concern for others, I think will bring them tremendous success. The world has got lots of illness, and illness is spelled I. It's only focused on oneself. Whereas if we could heal the world, then we'll have wellness, which is starting with the we, being there for others, not just narcissistically for oneself. And I think of a great doctor of the past century, Dr. Ludwig Guttmann. He was a Jewish doctor, a neurologist, I think, in Germany. He was the inventor, the creator of the Paralympics. And how did this all come to be? Because after Kristallnacht in Germany in 1938, he realized this was no longer the place for a Jewish person to be staying. And so he and his family fled to the UK. And there in Great Britain, he was hired at a medical facility where he noticed a lot of his patients who had spinal injuries were just left there dying away. And Dr. Guttmann decided to give them a chance at life. He believed in them. And he created activities, sort of athletic competition amongst the patients. And this got the patients active, no longer just atrophying, dying in bed, but instead he got them active in the hospital courtyard. And they had competitions, archery competitions, other sports, athletic competitions. This doctor changed the world for good, because as we know today, the Paralympics is just as important as the regular Olympics. And my friends, I think we think of the health professions. It's about bringing healing to the world. The Torah gives a doctor the instructions to be a partner with God in healing. God helps those who help themselves, of course, and we, as human beings, have to be a shining light to help those around us. To the healthcare workers, to the medical experts who give so many years of their personal life sacrificing to study medicine, to bring healing to the world, they are the greatest partners of God, and each one of us can emulate that by being there for others as well. Because when we save one life, we save an entire world.
late Professor David Bloomson was known as the heart and soul of the Baragwanath Hospital in Joburg. Today we chat to two people that knew and loved him, and we find out exactly what made him such a great person.
Through my training at Wits University, I went through, there's 3 teaching hospitals, Chris Hani Baragwanath, where Professor Bloomson worked, Joburg Jane Charlotte Maxeke, and Helen Joseph Hospital. And I think if you speak to any medical student who had been through Baragwanath Hospital for the last 30, 40, 50 years, Professor Bloomson was such a big personality and such a big person there that every medical student would know him. He would form part of your 5th year and 6th year medicine, internal medicine, teaching blocks. And like nobody else, he would take out always of his time to meet you in the corridor, to spend hours with you, to teach things to you, whether were they medical, whether were they about life, whether were about one of his vast interests like hieroglyphics or Semitic languages. And just watching him work, and as a mensch, which is an absolute gentleman in a loose translation, everybody was almost drawn and attached to him and had some sort of connection to him.
I remember how Professor Bloomson would constantly remind us that doctors are advocates of the poor. He decried injustice and would often describe the world that we worked in at Barra as being an unjust world. And he was a natural advocate of the poor, guided by such faithfulness despite difficult circumstances. And I would like to pay tribute to his wholehearted efforts to improve the quality of care and the conditions under which we as doctors can today practice medicine at Chris Hani Baragwanath Academic Hospital and beyond.
So Professor Bloomson was very openly Jewish and proud Jewish, and was a big seeker of peace. And if you saw him at work, he always had a mezuzah, which is a scroll on his door, a Jewish scroll on his door. And he was an expert in Hebrew and Arabic and all Semitic languages. He grew up in a very traditional background and was very proficient in all things Judaism. And he epitomized what it meant to be a mensch and to be a kind person and to live with Torah values and give them over to the greater world. Many people move on from government hospitals for the money or the fame, and he was there for over 50 years, working day in and day out, even when they didn't pay him anymore and he was retired. And you just having to watch him, there's thousands of stories of him, of how he treated patients, that if they didn't have money to go home in a taxi, he would give personally from his wallet. I saw him personally give his shoes to a patient because they were walking home and he was driving home. He really sat and spoke to them and cared to them, to thousands and thousands of people at Baragwanath. He was there for them. He was there for the students. He used to speak at the medics ball every year. He used to speak at the graduation every year. And he was just an icon and a legend of a person. You don't get people like that, where there's zero arrogance, even though you are so great in your profession as a physician, have published so much, have got so many accolades, and to the 5th year medical student, you're a friend.
So he really was a man for all seasons. He loved chess and cricket and music and reading, and whatever he did really well. So he didn't just play chess, and he actually taught my boys to play chess. He was a grandmaster of chess. He was also a master of Semitic languages, but he did his PhD in Semitic languages. And there wasn't a student at Barra who didn't have a card with their name written in hieroglyphics as proof of this from him. And he had such a fine sense of humor. He was my mentor on how to be a good doctor. He was my role model on how to be a good human being. But more importantly, he was my friend whom I could go to for advice. We would meet for tea on a Friday afternoon, for tea and a toasted cheese. And we were often joined by esteemed cardiologists and pediatric cardiologists and pulmonologists, all of whom adored and loved Prof. He really was so adored. So in particular, I had 2 colleagues, Deborah Weinberg and Renette Wheel, and we would make a point of meeting with him almost every Friday afternoon. And we would discuss life and medicine, and I learned so much from him. And I truly do miss him.
I remember once being in the ward round, and it was a whole mix of students, black, white, Indian, Christian, Jewish, Muslim. And I remember Professor Bloomson taking out a big X-ray envelope, a brown X-ray envelope, and writing for us on the envelope in Hebrew and in Arabic the word shalom and salam, which both mean peace. And he showed us the Semitic origins of the language and how they're the same, and brought it back to show our common ancestor Abraham and where we all came from. And he had that way of making us comfortable. There was no ever tension between what he believed and what others believed. He always seemed to bring it together so that he could relate to people of all races and religions.
So I think if Prof. Bloomson could have written the inscription on his tombstone, he would have written that I taught students in the wards, just as William Osler had on his tombstone, because Prof was a bedside teacher. I think we can all recall that there wasn't a day that Prof didn't walk into the ward with an X-ray or an ECG under his arm. He taught us to be good doctors. He taught us to be compassionate human beings. He taught us the values of truth and respect and dignity. He really was a special man who made a significant contribution to the lives of so many human beings. And so I tried to practice bedside medicine the way he did.
I think the community will remember him as being a beacon of light and the epitome of what a doctor should be. And the best part is that in the community, unless you'd been through medicine at Wits, a lot of people didn't know him. He wasn't there for fame. He wasn't there to be, wow, this award-winning doctor who discovered this and that, and who'd been at Barrett for 50 years. And there were many people who only discovered his greatness once he had passed away, unfortunately. He wasn't in the fancy hospital where everyone wanted to be, where you got paid lots to look after patients. He was in, really in the trenches at Baragwanath, and people will remember him for being an anav, which is the Jewish word for being so humble and having amazing humility, that there was absolutely no arrogance whatsoever, which is very rare to see among such an accomplished doctor. I mean, he taught generations, literally 50 years of medical students who almost all remember him from all races and religions, and he maintained those relationships over the years. So many people inviting him to his weddings, and there's a story of a Muslim cardiologist at the hospital where I currently work, who we were so close to, who he introduced to his wife. Professor Bloomson had an intern, a Muslim intern, and he had a Muslim registrar, and he introduced them together. They ended up getting married, and he was so close to them and their children that he just transcended every boundary that there was.
His Derech Eretz stemmed from the fact that he decried the injustice that was shown to underprivileged patients. And he wasn't just a man that showed kindness and compassion, but he was a man who took action, who wanted to do something about it. And that's why he was such a special man. And that's why whoever met him realized what a privilege it was to know him.
We all know that those who work in the healthcare field had to work incredibly hard during the peak of the COVID-19 pandemic. One of those individuals is Dr. Natasha Berkovitz, who received the Director's Award from the City of Cape Town for that incredible work. Today we find out a little bit more about why.
Growing up in Cape Town, I went to Herzliya, which is a Jewish school in Cape Town, right from back then it was Sabé until matric. We're quite a traditional Jewish family, so Friday night dinners are a big thing in my family. I think that's something special. And I did the traditional kind of Jewish things growing up, but it was kind of more a cultural part of my upbringing than a religious part of my upbringing. I did my internship in my comm service in Cape Town, and then worked at what we call primary care clinics in the public service. So these are largest clinics which are similar to GP practices, but mostly nurse run, and then you have doctors to kind of help with the more complicated cases. So I worked in that level of service for about 2 to 3 years. And I really enjoyed it. And I found myself working in Khayelitsha at one of the City Health's clinics there. And I came into contact with a lot of NGOs and research groups that are working in the area. And I've always been a bit of a health advocate, you know, fighting for people's rights and supporting them to have better access to healthcare. And I realized that seeing patients one-on-one wasn't going to make a difference to the population's health. Although I definitely, what I enjoyed about seeing patients one-on-one was that I could help that individual. I really wanted to help the community. And then after about 3-4 years in the research space, I started working here at City Health, where I get to contribute to the strategy of how we actually help the whole community in healthcare. How I look at the data and I see that TB is going up in this community, or HIV is going down in this community, or people aren't accessing their contraceptives here, or all these kind of things that really interests me. But specifically what interests me and what's unique for working in the city of Cape Town is City Health is just one department, and we have sister departments and other external departments which are responsible for so many things that contribute to the health of our communities. So whether people have access to water and sanitation, housing, transport, pollution, all those kind of things, and those make such a big impact on the health of communities. And the fact that I can work with teams that can change the living conditions that people live in, that will ultimately impact health, I think that's a real privilege. So I never thought I'd be dealing with an outbreak or a pandemic. We have localized outbreaks quite frequently of kind of minor diseases, but I don't think anyone really thought that we'd be dealing with something like this, although many academic colleagues, you know, they say all over the internet that this was just waiting to happen. So I got the Director's Award for my work that I did during COVID. As the epidemiologist, I had to assist the City Health Department at putting together a plan of how we contain the outbreak, how we work together with our Provincial Department of Health and our National Department of Health to address the COVID cases, prevent the spread, all of those kind of things. In addition to what I did within City Health, I also was the expert advisory person for the rest of the city of Cape Town. So it wasn't only the health departments responding, it was all departments could do and contributed what they could. So I gave my expert guidance as to how other departments and the disaster management teams should respond to the outbreak. I remember intimately when the first case was diagnosed in Cape Town. We had set up a war room kind of with some of my provincial health colleagues, and we literally sat in that room for the better part of a week, calling people who were diagnosed, contact tracing, trying to contain the outbreak. It was a very busy but very exciting time. I think anyone who's in the field would say that although it was exhausting, unless you've lived through another kind of acute outbreak, you wouldn't have got such experience. And so there was a real sense of camaraderie amongst all of us. Being part of the Jewish community and culture, I think that work community is really important, and I think any faith or community has kind of the same tenets. So that's I think we all based upon wanting to help your neighbor, and that's really been something that's instilled in me from a very young age. I must say, I think my upbringing, my mom especially, was really involved and still involved in a number of community organizations, and so her being a role model, I think, was a really important part of my journey. She always pushed me to help others first. And I always remember learning this at school. I don't know if it's actually a Jewish law or if it's just something that we were taught, but we were always taught to feed your animals before you feed yourself. And I think that's just such a beautiful, simple thing that really shows the ethos of the Jewish culture and the culture of community that we brought up in. And so that linkage towards charity and community, even if not explicit in my journey, was definitely in the background. My Derech Eretz, I think, has always been to give back. No matter what I'm doing, it's been about giving back to the people I love around me, my community, my country. And so whether I continue being a public health clinician or an epidemiologist, or whether I decide to go farm somewhere in the Cedarburg, it will always be somehow that I can give back to the people around me. And I think as South Africans, we have that unique drive to do that. And it's something that I've really only seen from South Africans. As a Jewish South African, I think that was instilled in my upbringing right from the start.
Well, we've come to the end of the show for this week's episode of Derech Eretz. As always, we'd love to hear from you, so please send us a Facebook message at Derech Eretz Connect. From me, Lauren Jaffe, and the Derech Eretz team, have a beautiful week.